So I asked him, I said, so Dr. Redfield, can you tell me, can I get an example of the science and the studies that the CDC used to make that social distancing 6 feet, etc.? And he had come to our office to have a discussion with a couple of my bosses, and I was there in part of the meetings. So I was walking with him after the meeting, and he looked at me and we got along well, and he chuckled and he said, Paul, science, this is para. What he said, science, there was no science. We made it up. And I was stunned. I stood there and I looked at him and said, Dr. Redfield, what do you mean made it up? And like I was laughing. And he said, well, you know, some people talk 12 feet, some said 9, some said 1, some countries talked about 3 feet. It looked like 6 feet would have worked. And so we went with 6 feet. And when I started to share this information, that I was so stunned and I couldn't understand how the United States, we made a 6 feet policy that businesses closed forever because of the 6 feet policy. People couldn't hold on in their businesses to have 6 feet between the 12 chairs that they had in their restaurant. They had to close. And some of those business owners self-harmed. We knew because the data was coming from the states up to our office at the HHS first before we wound it up to the White House. And I can tell you, they have business owners that committed suicide because of that 6 feet rule. It eventually destroyed their lives and their livelihood. And the reality about it, even Scott Gottlieb, I heard him say that once in a press release more recently, that the 6 feet rule was arbitrary and just made up. So I was vindicated because that was the fact. And it's really shocking that the CDC, etc., made policy like that affected the lives. It was not based on science. When Dr. Walensky came on the news last week before, and stated that, you know, CDC, we've made, at some point she said really dramatic mistakes